If you're over 65, how often should you still be getting hard? And more importantly, what does it actually mean for your health when you don't? Most men think erections are only about intimacy, but here's the truth. Many never hear from their doctors. Your erection pattern is one of the earliest warning signs of your overall health. So if things have changed, slowed, or stopped altogether, it may be telling you something important. Stay with me, because in the next few minutes, you'll hear a doctor's insight most men never get. And it could help you stay active, confident, and healthy for years to come. I'm Dr. Veronica Hayes. For more than 20 years, I've helped men over 50 stay strong, independent, and in control of their health. I work with patients every day who feel confused or even embarrassed about changes in their bodies, and I want you to know there is nothing shameful about wanting clear answers. My approach is simple. I explain things in plain language. I focus on what actually matters, and I always look at the whole person, not just the symptoms. So if you've wondered whether your erections should be happening more often, less often, or if changes mean trouble, you're in the right place. Let's go step by step, together. As men move past 60 and into their mid-60s, the body changes in ways that can feel surprising. And one of the first places those changes show up is in sexual function. For many men, erections become less frequent. Sometimes they are softer, sometimes they take longer to appear. And for some men, they seem to disappear altogether for stretches of time. Now here's the part most men never hear. These changes are extremely common, but they are not random. Your body is giving you signals about your circulation, your hormones, and even your stress levels. When I talk with my patients, the first thing I want them to understand is this. A change in your erection pattern isn't a failure. It's information. It's your body's way of telling you that something inside may need attention, sometimes small things, like poor sleep, and sometimes bigger things, like blood flow or heart health. And here's something important. Many men quietly ignore these changes because they feel embarrassed, but ignoring them can delay simple fixes that restore confidence and protect long-term health. So today, we're going to break this topic down clearly, without shame and without confusion, because you deserve to understand what's happening and what's normal after 65. Now let's walk through what every man over 65 should know. I'll keep this simple and practical. And remember, this is about health, not performance. Here are the 5 key things to understand about erections after 65. 1. How often should you expect an erection after 65? Most healthy men over 65 still get erections, just not as often as they did at 30. For many, once or twice a week is typical, including night or morning erections. It doesn't have to be on a schedule. What matters more is whether you're still having them at all. If they've become rare or stopped completely, it may point to changes in blood flow, hormones, or stress. Not emergencies, just signals to check in with your doctor. Now here's something surprising. Even men who are not sexually active should still see occasional spontaneous or morning firmness. These help keep the tissue healthy and maintain circulation. Second, why erections slow down with age? Think of your blood vessels like garden hoses. Over time, they stiffen and narrow. Smaller vessels show the changes first, and the ones involved in erections are some of the smallest in the body. That's why erection changes often appear years before symptoms of heart or vascular disease. Research from major medical centers shows this pattern again and again. So when erections become less predictable, it's not just aging. It can be an early tap on the shoulder from your cardiovascular system. This is why I tell my patients, don't see it as a loss. See it as valuable information. Third, the role of testosterone, but not in the way you think. Testosterone does play a role, but it's not the whole story. Low levels can lower desire, energy, and confidence, but many men with normal erections have modest testosterone levels. What matters is symptoms plus numbers. If your energy is low, mood is off, or erections have changed, a simple blood test can help guide the next step. And here's the reassuring part. Many causes of low testosterone are reversible. Poor sleep, long-term stress, low activity, even certain medications. Fourth, medications that quietly affect erections. This surprises a lot of men. Blood pressure pills, antidepressants, prostate medications, even some over-the-counter drugs, they can all reduce firmness by affecting circulation or nerve signals. This doesn't mean you should ever stop a medication on your own, but it does mean you can ask your doctor about alternatives with fewer sexual side effects. There are many options, more than most patients realize. Sometimes the solution is as simple as adjusting the dose. 5. Simple habits that improve erections at any age. These are not drastic changes. They're gentle adjustments that keep blood vessels healthy. A 20 to 30-minute walk most days. This boosts circulation more than people expect. Better sleep consistency. Your hormone system repairs itself at night. Strength training twice a week. Even light weights improve testosterone and blood flow. Limiting alcohol. It relaxes the nervous system, but it also weakens erection signals. Managing stress. Deep breathing, stretching, or quiet time helps the body send stronger signals. Small steps, big difference. I see this in my clinic every week. If all of this feels like a lot, take a breath. You're not alone. Every week, I meet men who come in worried or frustrated or even a little embarrassed. And the first thing I tell them is this: your body is not failing you. It's simply changing, just like every other part of life changes with age. Many of the issues we talked about today are reversible. Some improve with simple lifestyle shifts. Others respond quickly to medication changes or heart-healthy habits. Let me share a quick example. I once worked with a patient in his early 70s who thought he had lost his ability to get firm. But after adjusting one blood pressure medication and improving his sleep routine, his confidence came back within weeks. Not because we chased performance, but because we listened to what his body was saying. So please remember this: a change doesn't mean something is wrong with you. It only means it's time to check in with your health. And the good news? There are safe, smart, and effective ways to support your erections, your energy, and your overall well-being. You're not past your prime. You're just entering a new chapter, one you can navigate with clarity and control. Now let's turn everything we've talked about into simple actions you can use starting today. Think of this as your next steps checklist. First, talk to your doctor about changes you've noticed. Keep it simple. You can say, "My erections have changed. Can we check my circulation and hormones?" That one sentence opens the door to real answers. Second, review your medications. Ask, could any of these be affecting my sexual function? Doctors often have alternatives that protect both your heart and your confidence. Third, get basic health screenings, a blood pressure check, a fasting glucose test, a cholesterol panel. These reveal the hidden factors that influence firmness more than most people realize. 4, add small daily habits that support blood flow. A brisk walk, light strength work, consistent sleep. These are simple, repeatable, and powerful. 5, don't guess. Get information. If you're concerned, ask for a morning testosterone test. It's quick and helps clarify whether hormones are part of the picture. Now, here's what to do next in real life. Pick one step from this list and start with it this week. Not all 5, just one. Small actions create steady progress, and steady progress builds confidence. You deserve clear guidance, you deserve to understand your body, and you deserve to feel good about your health at every age. You've just taken an important step in understanding your health, and I want you to remember something. Your body is always talking to you. The more you listen, the more control you regain. Erections aren't just about intimacy. They're a window into your circulation, your hormones, your stress levels, and your overall well-being. So if you've noticed changes, don't ignore them. Use them as an invitation to take care of yourself with clarity and confidence. You deserve that peace of mind, and you deserve to feel strong and capable at every stage of life. Now, if you found this helpful, I'd love for you to stay connected. Subscribe for weekly, doctor-approved wellness insights. I'm here to guide you, support you, and help you stay healthy, active, and informed. Your health is in your hands, and the more you know, the better you'll feel. I'll see you in the next video.